In this video, we'll discuss important points for safe procedural and surgical mask use and reuse. The first step in donning a mask should always be hand hygiene. The same holds true for adjusting and doffing the mask. Be sure you rub all surfaces of your hands as you perform hand hygiene for a minimum of 20 seconds. A mask protects the wearer from spreading droplets, as well as protecting them from others. Place the mask on your face using all ties or ear loops. Completely cover the nose and mouth. Mold it across the bridge of your nose using both hands. While wearing your mask, be mindful of what you are doing with your hands. Avoid touching or adjusting your mask. Remember, the front of the mask is always considered contaminated. To adjust your mask safely, gloves are recommended. If gloves are unavailable, at minimum, perform hand hygiene before and after adjusting your mask. After making the necessary adjustments, doff the gloves if you are wearing them, and perform hand hygiene. Doffing a mask should be done slowly and deliberately to avoid self-inoculation or fomite transfer. There are several mask types with a variety of securements, so the important thing to remember is to grasp ear loops, straps, or ties only, and move the mask gently towards the trash or a safe location for reuse. When doffing masks with ties, the bottom tie should be undone first, to avoid the mask dropping onto your clothing. Generally, once removed, masks are discarded into the appropriate waste receptacle. However, in some situations, such as during a pandemic, it may be necessary to reuse the same mask or to wear a mask for an extended period of time to care for multiple patients. One method of managing a used mask is to place it on a clean paper towel on a flat surface. The paper towel should be labeled with your name and in a location away from patient care areas. Be sure that ear loops, straps, or ties do not contact the inner surface of the mask, as they are considered contaminated. Do not place the mask on the paper with the exterior facing outward. Do not touch the exterior of the mask as you doff it. Another method is to place the mask into a paper bag labeled with your name. Paper is selected because it allows the mask to dry and does not promote microbial growth. Once doffed, place the mask in the bag with the contaminated outer surface against the interior of the bag. Be sure the ear loops, straps, or ties do not contact the inner surface of the mask, as they are considered contaminated. If the mask becomes contaminated during doffing, it should be discarded. Safely donning the used mask again requires the same diligence as doffing. If you have access to gloves, put them on at this point, as you are handling a contaminated mask. The process of putting the mask back on will vary according to what type of mask you have. However, use gloves if they are available, and always perform hand hygiene before and after redonning the mask. While redonning your mask, it is important not to contaminate the inner surface of the mask. If this does happen, discard the mask. In general, when reapplying a mask, it should be grasped at the edges or by the straps to minimize the chance of contaminating the inner surface of the mask. During extended use, your mask may become difficult to breathe through or feel moist. When this occurs, the mask should be discarded. The following are examples of common ways in which masks are incorrectly worn. Wearing masks as depicted will increase your risk for hand contamination and self-inoculation.